So good evening, everyone. So glad that you could join us this evening. My name is Rhonda Haitz. Welcome to the Munroe-Meyer Institute's Family Care Enhancement Project Information Series. That's kind of a mouthful, but welcome. Tonight we're going to be talking about Medicaid waivers, Nebraska and beyond. I will be hosting along with my co-host Jennifer Hansen from the MMI as well. First things first, a little bit of information about our program that we work with. The Family Care Enhancement Project consists of parent resource coordinators who are throughout the state of Nebraska, some of us in Omaha at MMI on campus, others at clinics outside and around the state. And all of us are parents of children with special healthcare needs or special needs. As you can see, we've got locations in Kearney, Lincoln, Norfolk, Omaha, and future locations in Gering and someday, hopefully, Scottsbluff as well. So tonight, a few housekeeping items to quickly take care of. We are recording this session, so if you would be interested in going back and reviewing tonight's information, you can find it at this web address on our website. We do ask everyone to please mute your computers. We have kind of a large groups registered for this evening's session. So we just want to make sure that everybody has an opportunity to ask their questions and we're not talking over each other. Those questions can then be submitted to Jennifer Hansen. She's listed as one of the co-hosts in the chat box. And then towards the end of the session, we do have a poll that we ask for each of you to complete if you wouldn't mind. It helps us really gauge if these sessions are hitting the mark, if this topic is of interest, and if it's helpful to you. So tonight, we are very excited to have some amazing presenters. We have Denise Rozell, who is the Director of Policy and Innovation from the Association of University Centers on Disabilities, or AUCD, as it's commonly called. So she's joining us from DC. We have several parent advocates as well to share their family stories. We have Moriah Demers from Minnesota, Saige Vohs from North Dakota, and then myself from Iowa. So some general topics and some information about how we kind of came up with this topic. We have noticed sometimes when families are moving from state to state that they don't necessarily realize that there's going to be a change or maybe an interruption to their services depending on what the waiver programs look like in the state that they came from and where they're moving to. So this is something that we've kind of been talking about, like really kind of having a broader understanding of Medicaid waivers. So we're going to address that, some general overview questions or information, excuse me. Also providing some examples of how these programs differ from state to state because they do vary greatly. And then finally, bringing in that personal touch with also sharing how this directly impacts different families. And so that's why we have the family stories to talk about the programs and share their personal experience. I will say, since we opened up registration, I have received more questions prior to the session than any other session that we've done thus far. And overall, this evening, we won't be able to address questions about specific situations. There's so many different variables that we just won't be able to get into those types of really specific scenarios. But if you do have questions or would like to contact either Jennifer or myself to follow up with you and to provide whatever resources or information that we can to you, we'd be happy to do that. Go ahead, here's our information, our contact, email contact information, and let us know kind of what's going on and if there's some way that we can help, and we can maybe at least try to steer you in the right direction or get you to some other possibilities of places that might be able to help. So without further ado, I will go ahead and let's invite Denise to share her knowledge of the Medicaid waiver systems.
There we go. It said the host had to unmute me. Okay. Hi, everybody. So my name is Denise Rozell. I am, as Rhonda said, my title is Director of Policy Innovation. Basically, what that means is I'm a policy geek. I love policy. I love teaching people about policy. I love explaining policy. I love helping people get involved and think through what policy looks like, systems change, all kinds of things. So I'm a policy geek. Know that going in. I am not an expert on Nebraska, so I'm going to put that out there to begin with, or even on the Nebraska waivers. I'm here to do kind of the 50,000 foot view. And do you have, Rhonda, do you have my slides? I'm not seeing them, that's all. Okay, I'm here to do kind of the 50,000 foot view of waivers. What are they? How do they relate to traditional Medicaid? What are they about? What are the best, what's good, what's bad? That kind of stuff. So I'm prefacing this with I'm not an expert on Nebraska. I've been to Nebraska, but I'm not an expert. I am, in some ways, I wouldn't even call myself an expert on waivers, although I suppose I know as much about them as many people in the DC area. I understand them and what they're about. There are people who are so down in the weeds on waivers that they will quote, you can go down that rabbit hole really quick and be lost really fast. So if we get any questions for me that I just think, no, I need to take that too, then I'll do that. I'll take that because there are two people I go to when I'm just like, oh my gosh, I have no idea what you are talking about right now. And they're my experts. So if something comes up, I am happy to do that. So if I say to you, I'm not sure, I'll find an answer for you, at least at that 50,000 foot level. I think that's enough. Let's go to the first slide. Okay, so let's talk about Medicaid first. Medicaid, got it? There we go. Medicaid is what's called a state-federal partnership. What that means is the federal government has passed a law, Medicaid. There are requirements under that law, and they pay money to a state to participate. But the state has to also put in money. So that's why I say it's a state-federal partnership. The federal government puts in some of the money, the state puts in some of the money. What's interesting about it is that, and there's a percentage. If you ever hear something called the FMAP, don't worry about it, but that's the amount of money, the percentage that the federal government puts in, like 50% of the 65%. And it's all based, that formula is all based on the standard of living in the state and demographics and all kinds of stuff. States differ. So there's a different percentage for how much the federal government puts into Nebraska than what the federal government puts into Rhode Island, than what the federal government puts into California. And the state makes up the difference. Okay, 74.6 million people were on Medicaid in FY 2018. 1 out of every $6 spent on healthcare in this country, all healthcare, is spent on Medicaid. And it covers 1 out of every 5 people. Medicaid is a program targeting low-income children and families, low-income seniors, and low-income people with disabilities. You notice the low-income part. I'll come back to that in a second. There is an income threshold to get into Medicaid. That's why you hear people talk about spending down to get into Medicaid. You can't be somebody who's getting, I would start to say a lot of money, but frankly, it's pretty, you can't be somebody getting even some money. It's a pretty low threshold that you have to get to. I said that backwards, but you can't make very much money at all and be in Medicaid. The numbers are interesting. Medicaid is what's called an entitlement program. That means that if you meet the terms, you have the low income, you have the income eligibility, you meet that, you meet the other requirements, you automatically you're in the program. There's no wait list for Medicaid. This is, again, traditional Medicaid. I'm going to juxtapose traditional Medicaid and waivers. So here we're still talking about what we call traditional Medicaid. Okay, in traditional Medicaid, you are entitled to be covered and get services if you meet the requirements. And there's no cap. There's no on the federal government portion. So, if there are 100 people eligible in Nebraska who meet all the requirements, 100 people get it, and the federal government pays, say it's 65% of all 100 people. If there are 1,000 people, if there are 10,000 people, if there's 1 million people, there's no cap. You are entitled to the service if you meet the requirements. Okay. Again, traditional Medicaid. Let's see, what else should I tell you? There are some services that are required to be covered under Medicaid. There are some services that are optional under Medicaid. Again, on traditional. So a state has to provide certain services. Other services are optional. Now, one of the things that's interesting, I suppose, is that nursing home services are required services. You must provide, the state must provide those services for people who need them. What we call home and community-based services, the services that go with living in the community, are only optional services. That's what's oftentimes known as the institutional bias in Medicaid, meaning there's a bias toward being in the in the nursing home, because the nursing home under Medicaid will pay. So the federal government will pay what, or the federal and state government together. Again, remember, Nebraska is putting in money to this too. Will pay if somebody needs, if I need to be in a nursing home and I meet the income eligibility, so I don't make very much money, I have a right to be there and my services will be paid in that nursing home. If, however, I want to stay in my own home and I don't earn very much money and I meet all the other requirements, et cetera, and I want to be in my own home, and Nebraska, I don't know what Nebraska, I don't know if you offer it under traditional Medicaid, I doubt it, in traditional Medicaid, and they don't offer that service as an optional service, I'm either home without the services or I'm in the nursing home. So that's, again, keep in mind, but that's the difference. That's part of the difference with traditional Medicaid. Okay, so those are the requirements. And the other thing you should know is that Medicaid is one of the only places that you can get coverage for long-term services and supports. Most private insurance does not cover it. Medicare doesn't cover it. People pay out of pocket or they get it through Medicaid. That's how you get long-term services and supports in this country. But that's, again, why you hear, for seniors particularly, why you hear conversations about I want to stay in my home versus I want to go to the nursing home, or the nursing home. Medicaid will pay for my ability to be there, but they won't pay for the services I need to stay home. It's an institutional bias. That's what it is. Okay, so again, this is traditional Medicaid. So keep that in your head. Okay. I'm trying to think if there's anything else. You should also know it's interesting. A lot of times we hear about how Medicaid costs so much. It costs so much of the federal government. It costs so much of the states. The biggest program that from the federal government bringing money into a state is Medicaid. Medicaid brings the most federal dollars into your state, period. So it's both an income into your state, but then Medicaid in your state is generally, and for almost any state, it's the first, second, or third biggest item in your state budget as well. So, usually up there with K-12 education, Medicaid, maybe higher ed, though usually not. So it's both brings money into your state, a lot of money, more money than anything else from the federal government, but it also costs your state more than most things. So that's that, again, that balance of, it's a balance of what does it cost the state. And it's often why you'll hear from state legislators how expensive Medicaid is. It is, but also we bring in money, or you bring in money from Medicaid. Okay. Are you still with me? I hope so. This is complicated stuff, folks. I'm sorry, I am. It's complicated. Okay, waivers. Now let's talk about waivers. So we talked about traditional Medicaid. Medicaid waivers are exactly that. It is literally a waiver of one of them or more of the Medicaid requirements. So I said Medicaid, for instance, there's an income eligibility requirement. Okay, maybe the waiver says you don't have to have that income anymore. You can have a higher income. So you can waive eligibility. You can waive benefits. So maybe there are mandatory benefits. I said a minute ago, there are mandatory benefits for Medicaid. So maybe you're going to waive some of those benefits. Traditional Medicaid has to be applied across the state equally. Well, maybe you're going to waive the geographic requirements. So you're only going to have this particular waiver of these services and provide these specific services to try them out in the Omaha area. You can't do that under traditional Medicaid. Traditional Medicaid has to be statewide. Block grants, that's a little, let's skip over the block grants. I'll talk about that in a minute. You can create, restrict it to a specific network. That's what's called managed care. I'll come back to that in a minute as well. But just for right now, know that a lot of Medicaid waiver services, a lot of Medicaid period right now is provided through managed care. That's true for seniors. It's becoming more and more true for people with intellectual and developmental disabilities, but it's very true for seniors particularly, and other people on Medicaid. So, you know, you have other low-income folks on Medicaid. Lots are being provided through managed care, which means you can only go to a certain network. You know, it's Kaiser, it's United, it's Anthem Amerigroup. So that's all you can do. Now, there's some advantages to that too, but you can restrict that. You can provide to additional coverage groups, so you can expand it. Perhaps you don't normally cover, for some reason, people with traumatic brain injury don't normally get covered. So you can do a waiver that's specifically for people with traumatic brain injury to provide a specific amount of services in a specific way in a specific area. That's something you can do under a waiver. For years, I think you guys used to have an autism waiver too. For years, until the federal government said that you could do, autism services could be covered under traditional Medicaid and should be. There were autism waivers that were specifically set up for specific services for people with autism of specific ages. And it was through a waiver, meaning they've applied to CMS, to the department, to the federal government, and said, here's what I want to try. I, Nebraska, want to try to do something different to see how it works in my Medicaid program. And what I want to try is specific services for kids with autism from 0 to 8. They can get ABA services, and that's what I want to do. And I only want to do it in the western half of the state. Well, if that is proposed and the legislature agrees, you jump through all the hoops, which I'll talk about in a minute. But if you jump through all the hoops and it gets approved, then that's what's called a Medicaid waiver. You've waived something. Okay, and it has to be approved by the federal government. That's the Center for Medicaid and Medicare and Medicaid Services. Has to approve any waiver. Okay, next slide. How is it different from traditional Medicaid? So waivers, basically waivers pay for services in the community. So think long-term services. The traditional Medicaid tends to pay for doctors, therapy, medicine, hospitals, but not community services. So think healthcare, institutional care, hospitals care. That's kind of a little different. The other thing is, again, think entitlement. No, it's entitlement. I would say that. So traditional Medicaid is an entitlement. If you meet the requirements, you're in. Waiver services are not that way. Waiver services, you can also limit the amount of participants. So maybe you're saying you're only going to accept 150 people in this Medicaid waiver on autism services I was using a minute ago. So if you're the 151st person, you're on a wait list. And you can do that in waivers. You can't do that in traditional Medicaid. On the other hand, you might get services in that way. Again, for a long time, ABA services weren't covered under traditional Medicaid. So maybe you're going to get different services, better services, services that you need that traditional Medicaid won't supply. And if you're in the first 150, great, but you may be sitting on the waiting list. And I'm guessing that a lot of you understand waiting lists, and I'm really sorry about that. Okay, next slide. Another important thing, maybe the most important thing about Medicaid waivers. In order for the federal government to approve a waiver, the waiver cannot cost any more of the government than what they would normally put in. So estimated federal spending, that's that government part of Medicaid funding, over the period of the waiver can't be greater than it would have been without the waiver. You can't spend more money in waivers than you would have in Medicaid. It's called budget neutrality, cost neutrality. And there's this whole, they go through this long process to figure out how they estimate what the costs would be for this and for that and for something else. But that's another reason that they can limit the number of people, because if it, a way of limiting it. So you've done your work, and if it's going to be, you're going to supply 5,000 people, all of a sudden you can't meet cost neutrality anymore. It's going to cost more than Medicaid would have cost. Oops, you can't do it. So now maybe you're only going to cover 100 people. That gets you underneath the cost limit. So again, it's a big balancing thing. CMS does all of that work, but it's a limitation on what can be done in a waiver. And most importantly, it tells you why you get waiting lists and why that's different. Okay, next slide. Types of waivers. I'm not going to go too in the weeds on this, because frankly, you don't need to know the difference between a 1915B and a 1915C and a 1915I and a 1915K and da, 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 da. What you really need to know is there is freedom of choice waivers. The 1915Bs tend to be where you see managed care waivers. There have been a number of like I said, lots of states have managed care waivers where they are requiring people in Medicaid for certain services to be in a managed care, to have all of their care, their health care and their long-term services in a managed care environment. Some places, Rhode Island has that statewide. They have a statewide waiver for managed care. Some places have piloted it in certain areas. I know you guys looked at that, I think a couple of years ago, decided not to go the managed care route. Iowa, Rhonda probably can talk about managed care in Iowa, which again, there are good things and bad things about managed care. You sometimes get get different, more expanded services, but on the other hand, there are some downsides to managed care too, particularly for folks with ID and DD. Okay, and then the 1915C, those are home and community-based services waivers. That's really what we're talking about here. It's what Nebraska primarily has. I did look that part up. And it's how you get home and community-based services, or let's do it the other way. It's how you get services in the community instead of in an institution, is by some waiver that says you don't have to be in the institution, forget that institutional thing. You can be in the community, but I can only do this many of you, or you can only spend this much. Okay, the other waiver that 1115 waivers are research and demo projects. Again, they often are they're not interchangeable, but I'm not sure you need to know as much about the weeds on all of it. The bottom line is it's to try, any waiver is to try something new and see if it works. Do a research and demo, do a pilot, see if it works, if it saves money, quite frankly, because that's part of what this is about, like it or not. So those are 1115s. Again, I'm not sure getting in the weeds here is that big a deal at the moment. Okay, going to the next one. Okay, we talked a little, I started down this one, waivers. One of the most important things about waivers, and I've talked about some of this, so let's just go through. One of the most important things about waivers is it's the alternative to institutional care. And that's part of, that's why it's called the home and community-based services waiver. It's, it includes services that can be given to you to avoid institutionalization. That's kind of how it's set up. The idea is that, quite frankly, the idea is people want to live in a community. Gee, what a surprise. This is not the paradigm that we used to have. The paradigm we used to have, my aunt, who was born around, I don't know, 1915 maybe. Anyway, the only thing they offered her was go to an institution. Now, my grandfather thought that and that didn't happen, but there's a whole different history there about where the best place was for people with intellectual and developmental disabilities. Well, these days, folks want to be in the community. But unfortunately, the Medicaid system and the statute hasn't moved to a space where that is the priority or the favored outcome. We're getting there, and the numbers are beginning to get there. And there's good things about that, but we're not there yet. And the statute itself hasn't changed. You still have to go through a waiver to get those services. Okay, I said before, you can waive income levels, you can target specific populations. That was my autism or my TBI example. You can cap the number of participants. You can cap the amount per participant. That's another way to avoid cost neutrality. So it's a way to say, I'm going to have 100 people, but I can only spend $100 each, because if I go anywhere over 100 times 100 is what? 10,000. If I go anything over that amount, I can't meet cost neutrality anymore. So that's another way that you'll often see a cap on the amount of money per person. But those services in the community, to keep people in the community, there's a whole host of those services that can be provided through waivers and are in various states. Case management, adult day, personal care, respite, habilitation services, home health aides. I'll talk about some, there's employment supports, there's housing supports, there's family supports. You guys are talking about that now in your state. There's all kinds of services that can be vehicle modifications, home modifications, all kinds of things that can be provided under these waivers, as long as those services are what's written into your waiver for Nebraska. Okay. And again, the bottom line is to think about the fact that waivers are to avoid specific placements. So, you know, mental health waivers are often to avoid some kind of placement in a mental health institution, or a DD waiver is to avoid placement in a DD institution, or some of the waivers are to avoid placement in nursing home. We talked about nursing homes a minute ago. Hospitals, what I think in one of the later slides out of Katie Beckett, that's to avoid hospitalization, a hospital level of care. Somebody needs a hospital level of care but wants to be in the community. So, okay, let's go on. That's good. There's Katie Beckett. So the current waivers in Nebraska, you guys know more about these than I do probably, or if you don't, Rhonda does, and Jennifer does, and Sarah does, and some others do. So those are the waivers you already have, okay? There's not a waiver specifically targeted to children in Nebraska that I could find. There are some waivers that cover children, but not that are specifically targeted, and we'll talk about that in a minute. The only one, the Katie Beckett waiver is a little weird. It's a waiver, but it's not really a waiver. It's created differently. It was created by a piece of legislation. It actually was created because Katie Beckett wanted to be home with her family, and Katie was a little girl with some very significant needs, basically hospitalization level needs, some very significant medical needs, and she wanted to be at home. And this waiver was created and named after Katie Beckett back 40 years ago, maybe. So anyway, it covers, what it says is it's Medicaid coverage for children who would otherwise have to be hospitalized. It was written into, it's sometimes referred to the TEFRA waiver. Again, you don't need to know that. It's a piece of legislation that created it in the federal government, but it's called the waiver, but it's a different pot of money. So if you're getting Katie Beckett services, those services aren't necessarily counted against your waiver dollars. I told you this was complicated. I warned you, right? Okay. But so what it does is it just looks, when you're looking at income, it just looks at the kid's income, not the parent's income. So you can therefore meet the income eligibility requirements that are otherwise there. That's the bottom line. Okay, so next slide. You now know a lot, kind of everything I know about Nebraska's waivers. That's not quite true, but almost. Okay, what are the advantages of waivers? Let's go back for a second. States can experiment with different approaches. So if you want to try managed care and see how it works for a 5-year period, and you apply and you get it approved, you can try it with a population in a place, and lots of states have done that. Particularly for managed care, they've done it with, usually not with the DD and IDD population. Usually that population has been carved out. They've tried it with pregnant women or working adults or low-income adults, other populations. But anyway, you can try different approaches. You can provide services that otherwise wouldn't be provided, either otherwise wouldn't be provided under traditional Medicaid, or aren't provided under traditional health insurance, probably both, actually. States can save money. This is not, it may not be the most important thing in our lives to say that states have to save money when you're trying to get services for your kid or for yourself. But for states, it means that they have funding predictability. They know there are this many people at this cost that they're going to have to provide under this waiver, and that they can budget for. So from an advantage, from a state point of view, that's important. It's tailor-made for a specific population or specific services. I used the autism example a minute ago. TBI is another one. HIV/AIDS is another one, where there are very specific services for very specific populations. You waive some of the other requirements under Medicaid. Here they are. It can cover people who wouldn't meet income eligibility, meaning working age adults who might make more than you can make to be on traditional Medicaid, but you make too much to be on traditional Medicaid, but not enough to really be able to cover the services that you need for your kid. We all know, I mean, I used to say to people, you know, $40,000 income for a family of 4 is one thing. $40,000 income for a family of 4, which includes one child with a significant disability, is something completely different. And so, you know, you can create a waiver that says, well, you know, Medicaid, again, I'm making up numbers again, Medicaid, you have to be very low income. So it's like 100, oh, it's 100% of the poverty level. So underneath the poverty level. So maybe it's, you know, $20,000 a year, maybe. But if you create a waiver that says, well, actually, you can make up to $40,000 a year, or you can make up to $50,000, whatever it is, because it's just more expensive to be a person with a disability in that period. I used to talk when I worked for Easter Seals for a long time. I worked for Easter Seals for 15 years doing state government relations. And we used to talk about, you know, just the price of diapers, just the price of special food, just the price. And those things are not covered on your private health insurance. That stuff's coming out of your pocket. So if you could create a waiver that allows for you who makes more money than Medicaid, traditional Medicaid, but not enough money to really be able to afford to pay for the things you have to pay for, then that's a waiver that you could create. And obviously HCBS waivers, that's the whole goal is to avoid institutional care and to allow people to live where they want to live. That's the bottom line. It's choice. It's to allow people to live where they want to live, wherever that is. Okay, next slide. I am talking at you a lot. I'm watching my time. Yeah. Okay. We talk disadvantages of waivers, cost neutrality. So, you know, you have to meet cost neutrality, which means you're always looking for ways to save money to get underneath that cost neutrality. You want to expand services, but you got to keep it neutral. And that creates waiting lists. And that's a big thing. The other thing, and this is something that I was talking with Sarah Swanson and others about, okay, remember everything I've said about this and about the state federal partnerships, Medicaid waivers are different in every state. And I think that's what some of the stories you're going to hear in a minute are all about. You can't move from one state to another and think that you're going to get the same services in one state as in another. Why? Okay, one, the federal investment in Medicaid is different in every state. Remember, I was talking about the percentages. The feds put in different percentages based on geographics and demographics and income eligible, all kinds of things. So, you know, in state A, the federal government pays 69% of the Medicaid budget. In state B, they pay 79%. And in state C, they pay 50%. Those 3 states can't provide the same kinds of services. They can't afford to. Secondly, every state is looking at this differently. And again, this is not a political statement as much as it is, there's different interpretations on what you need. People in California are going to, no surprise, people in California are going to have a different interpretation of some of this than somebody in Florida or somebody in Nebraska or somebody in Wyoming. You just have different needs. You may have different amounts of money your state is willing to spend. You may have different perspectives on, frankly, you may have a different perspective on what government should be providing and shouldn't. All of those things mean that every state applies for their waivers separately, and every state gets approved separately, and every state therefore has a different way of approaching them and different services. And even if you find the same services state to state on waivers, again, waivers, Medicaid, there are standard required services in Medicaid in every state. But when you're talking waivers, it's very different. And you really, if you're planning on moving, the best thing I can say to you is do research before you do it. to see what that state offers, what waivers are available, what the waiting lists look like, how much they'll cover. Do your research. I hate saying that to you. I absolutely hate saying that to you. That is my personal opinion. That's not right. You shouldn't have to worry about where you're moving and whether if we're talking here families, if your child is going to get the same services in A as in B, but you do. You do. Okay, next slide. Let's see what else I got. Trends. There are only a couple of these I'm going to highlight, and we can have a longer conversation if you want to talk about it. There are obviously, as waivers expand, as things are happening, I talked a lot about managed care, trends in waivers, things that you're seeing in other states, things that you're seeing at a national level. You know, a variety of states are trying out. Managed care is one. The block grant cap spending thing is, I think I'm going to skip that one too for the moment because it's complicated and I'm not sure. That may be way too in the weeds. We can come back to it if somebody really is interested. Coverage of employment services. We're seeing more and more coverage of employment support services under waivers. Things like pre-voc services, things like, I'm looking at my notes, career planning, supported employment, customized employment, job coaching. In some states, those things are actually being covered under waivers, particularly for the IDDD community. That's really who I'm talking about here. Because frankly, we recognize that employment, your healthcare ties into your employment and vice versa. Transportation, you know, if you can't get to work, it doesn't much matter if you have a job, right? So transportation as a waiver service, if it's transportation to employment, there's a lot of experimentation going on in that right now, and that's a really good thing. Other kinds of social resources, housing. There's housing supports are being covered in a variety of waivers in other states, and that's everything from helping. It's not paying your rent necessarily, but it's helping you understand how to move, helping transition, particularly for people with chronic homelessness, transitioning into an apartment, for instance, for an individual. That's in one state. Supporting people to maintain tenancy. Other things on housing, tracking community resources, targeted case management for specific populations. Particularly, you see that for in the behavioral health arena, very targeted behavioral health case management. There are all kinds of things. That's the social resources piece. Peer supports are being covered in some waivers. There's a lot of really interesting things that people are trying. Again, keep in mind, waivers are for trying things out. There's some interesting things that states are trying. The effect of COVID on congregate settings, I mentioned that as an aside, but I couldn't, given COVID these days, I can't move away from that without just doing a sentence or two. Part of what we're seeing right now is that, again, COVID tends to spread quickly and easily within congregate settings. We've seen a lot of outbreaks. We've seen deaths. There are tragic stories in the disability world about people in various congregate settings being exposed to and then having COVID and spreading through that setting. So part of what it means is that we're seeing more people who want home and community-based services. They want to be out in community. And that's going to have some effect on waivers. I don't know what that's going to look like eventually, but it is. Let's go on. Okay, EPSDT. I do need to say a word or two about EPSDT. Don't you love how that just rolls off your tongue? Acronyms in the federal government. Early periodic screening, diagnosis, and treatment. EPSDT. Now this is for kids. This is very kid specific in traditional Medicaid. So again, go back to traditional Medicaid versus waivers. In traditional Medicaid, kids are treated differently, and as frankly they should be. One of the things traditional Medicaid requires comprehensive services for kids under 21. If they've been screened and diagnosed, then they're entitled to the treatment as well. They're entitled to all of those things. It includes dental, vision, hearing, medical, therapies, home health. It includes a whole host of things that you are entitled to, as your child is entitled to. We used to talk about the shorthand was if if a kid who's on Medicaid, now keep in mind, there's still the income requirement and some other things. Remember back when we were talking about traditional Medicaid. If you meet the income, family meets the income requirements, all of those things, the child is entitled to these services. If you need it, you're entitled to it. I would be the first one to tell you that that doesn't always work that way. I'm sorry about that too. I know that it doesn't always work that way. It's supposed to work that way. And if you're stuck in a situation where it's not, I suggest you go to your protection and advocacy system. Just saying, it's supposed to work that way. But again, it's traditional Medicaid. It is tied to medical necessity. So it can't be an experimental treatment. They can refuse to do it without, they can tell you have to do a more cost-effective alternative. They can tell you that certain things are not covered. Because they think you should take the alternative. You can fight that, you can challenge it, but that's kind of what it's about. The idea is that kids should be able, particularly low-income kids, should be able to get what they need. And it's it goes into the theory of early intervention and getting kids started early, and what's that going to mean as an adult, and the more we can do early, the better. So it's something that Medicaid provides. It's very broad funding. You still, like I said, medical necessity, so it's not likely to cover like vehicle modification, right? It's got to be medical necessity. I guess I could argue in some cases for medical necessity for vehicle modification, but it would be an argument. So that's EPSDT. Again, kids, traditional Medicaid, you get what you're entitled to. Okay, next slide. Now, how do waivers tie into that? EPSDT is not a waiver, so you have to meet medical eligibility, Medicaid eligibility. Medicaid waives something. This doesn't. So if you're in traditional Medicaid, EPSDT, you can also be in a waiver. And sometimes those services are different. Like I said, maybe it's an experimental treatment that's provided under the waiver, but it's not provided under traditional Medicaid. So, they may overlap. You may be able to get services under each. You have to look into it, but it's a different pot of money. That's the most important thing. EPSDT comes out of one pot of money, waivers comes out of another. Okay, and services, the other thing is services under EPSDT are often services that are not covered by insurance, by private insurance. We all know the limitations of private insurance. Okay, next one. I'm almost done, and appreciate the fact that you're still with me. Family support waivers. I also just wanted to pull this in because I know this is something you guys are talking about in Nebraska. EPSDT, so family support waivers, a little different. Another type of a waiver. Remember, waivers waive something. In most cases, family support waivers waive income eligibility. So it's for working families. Again, maybe the family's making $40,000, and that's not low enough for traditional Medicaid, but it's low enough to get in your family support waiver and give you a whole bunch of other services that you might have gotten under EPSDT, but you didn't because you can't meet the income requirement, but you could get them here. And you can't get them under private insurance because they're not likely to cover them either. And again, these are the kinds of services I was talking about a minute ago. Supports for the family. Actually, I think I have a slide. Flip to the next slide. I think is it the next one for Maryland? Yeah, so Maryland has a family support waiver, for instance. And the services that are provided under their family support waiver, again, it's for working families, basically. Behavioral supports, assistive technology, environmental assessments, family and peer mentoring, family caregiver training, housing supports. You can see personal supports, respite. Those are a lot of those services are things private insurance won't cover. And if you make too much money to be on traditional Medicaid, you're out of luck. It's coming out of your pocket. But if there's a family support waiver, at least in Maryland, this is the way this one works. Those kinds of services can be covered. Okay, flip back one, and I think we were done with that anyway. So I'm going to go on. Oh, the other thing about family support waivers and about many waivers is that they are often self-directed and on a whole person-centered planning kind of model, which is awesome. And it often includes a capped budget. So you get this much money to spend on whatever it is you need as a family to support your child and your family living in the community in these kinds of supports. So that's a capped budget that the families get to choose how to spend. It's, I was saying before we got on the call, I have a friend who has twin sons with autism, They spent some of their family support dollars on the boys going away to a special camp because that was respite for parents. It was useful for the kids to be away. It was a supported camp environment. It promoted independence. It fell under their waiver. And that's part of how they used their family support dollars that year. And it was a it was a godsend for everybody. So that's what that was about. Okay. Okay, let's go. Flip the family support one. Is that it? Next slide. Process. We've kind of talked about process. The way this works, a state develops a waiver request. Now, it depends on your state, how that happens, whether it's a piece of legislation in your state, whether a state agency develops it, depends on the state law. But the state develops what they want to do. Maybe the DD Council said, this is what we think we need, and the state agency agreed. However it happens in your state, the state develops that waiver request first. They submit it to the Center for Medicare and Medicaid Services, which is the federal agency. CMS evaluates it. They usually go back and forth a lot. Yes, you can do this. No, you can't do that. This is going to cost too much. You over cost neutrality, you under cost neutrality. There is always a public comment period. There is always a public comment period at the state level, and there is always a public comment period at the federal level. And those public comments matter. So let me just say that. And then the waiver is approved or denied. It's usually approved for some, depending on the waiver, for 3 to 5 years maybe. And then they either have to apply again or apply for a different waiver. Keep in mind, again, these are supposed to be pilots or demos, so they apply whenever. Okay. Yeah. Next slide. And that goes to why do we need to be involved in this? Why do we need to care? Well, there are several reasons that we need to care. One, because if you've got a little kiddo, or if you are a person who has disabilities and you need to know about Medicaid and waivers, period. That's the first thing. In your state, the state and federal budgets are going to be strapped this year. So, there's going to be, I guarantee you, in your state and probably every state, there will be a conversation about whether we are spending too much money on Medicaid from the state point of view. And if the state believes we are, or if people in the state believe we are, then where are they going to cut? And that's a conversation that will happen. So to the extent that you are an expert in these things and you understand how these work, or you understand the needs of your family, sharing your expertise and your experience is important. COVID, congregate care, we talked a little bit about that earlier. And as I said at one point, I think the demand for long-term services and supports is high, and that need is growing both as a function of COVID and congregate settings, but also as a function of, the generations that are coming along, the post-ADA generation, the post-IDEA generation, the folks who are coming along who are expecting to live in the community. The percentage of folks who have been included in whatever, school, work, particularly the IDEA kids who have come along and are continuing to come along, they expect to live in the community. They expect to work. They expect to be able to earn an income. They expect to be able to get health services that they need to be able to go to work. They expect to get personal attendant services they need to go to work. The place that a lot of those services come from, some of them come from private insurance, but a lot of them come out of Medicaid, and a lot of them come out of Medicaid waivers. So your experience and your expertise is hugely important. That's the last slide. What I'm going to say is, if you lasted through all of this, I am so freaking impressed, because this is hard. If you take anything away from this, it's that you need to know about it, that it differs state to state, that there are possibilities out there for doing it differently, and to learn from other states and to see what's possible. But to do that, you have to understand how the system works, and the system's hard. And I guarantee you, there are people in your state who understand the Medicaid system. So if it's something you didn't get, or that you just kind of went, oh my, Denise, if you lost me 20 minutes ago, first of all, I'm sorry. But secondly, if you lost me 20 minutes ago, there was somebody in your state who can explain it. I guarantee it. And that's a good thing. Okay, I'm going to shut up now. That was, much longer than I expected to be. I apologize to my hosts, but if you've got questions for me now, I'm happy to try to take some of those. I'm also happy to, and I'm going to hang out. I'm really excited to hear the family stories because frankly, you don't always know, but you never know. You never know how it really works on the ground. If you're a DC person, policy wonk, the only way I know how it works on the ground is to hear it from you, because you're the ones who know how it works on the ground. And then I can take that and say, oh, okay, so here's what the policy is supposed to look like. Here's what's actually happening. Is there something we can fix? Can we arrange that? Can we help with that? What can happen? What can I do? But I don't know what to do until I hear from you how it's really working. And that is also different in every state. So that's it. Questions?
Denise, I would just like to say thank you so much for providing that information to us, because I think it really helped kind of clear up some of the things that are difficult. And it's a very complicated system. It's very difficult to kind of maneuver through that. So I so appreciate you sharing your expertise. Jennifer, have we had any questions come in through the chat?
Yes, we've got just a couple. So the first one is, since waivers are set at an institutional level of care, is there a concern that with states closing institutions that it is more difficult to start a new waiver or demonstrate cost neutrality?
Well, that's an interesting question. I don't think so, no, because when you're talking about institutional level of care, it doesn't actually mean there has to be an institution. It's a definition of what's that level of care that would be. But that's a really good question. I hadn't thought about it quite in those terms, but I don't think so. Partly because there are also, partly because we still have institutions. But there's a level of care. It's a level of care definition, not the fact that there's actually an institution. I suppose if and when we get to a place where there are no more DD institutions, that at that point, we might have a different conversation about this, or mental health institutions, or nursing. The nursing homes are in kind of a different category. There's a nursing home level of care definition too, but that's an interesting question. Good one.
Okay, another one about level of care. Have you seen any waivers that require the hospital level of care, but also provide employment services as part of the waiver?
Okay, remember at the beginning when I said if I didn't know an answer to something, I was going to try and find you an answer? Because that's also a really good question. And I don't know the answer to the question. I'm guessing there is, because I know people who have hospital level of care who work, but I don't. Where's the waiver? I don't know. So I am writing that down. Okay. I don't know, but I will find out.
Okay.
I will say the only thing I will add is we're seeing the employment supports expand, but there aren't a lot of places yet who are including them in the waivers. They're there, but it's not like every state is recognizing that yet, or if it says it in the waiver that every state is really doing it. We're getting it. That one's growing, but and there's certainly a recommendation. You can go to the Medicaid website at CMS, and like right on the front page of waivers, it says something about employment. So it's absolutely covered, but I'm making a note to myself.
The last one is about EPSDT. Does that cover a medical immunodeficient issue for a 17-year-old? If that's, I don't know if that's too specific.
It's kind of specific, but I would guess it should, if it is, I mean, early periodic screening, diagnosis, and treatment, it goes to, I believe, 18. So if it's, you've been screened, diagnosed, medical necessity, and there's a service available, and it's not experimental. And so I would ask the question and see. I would think it should, but complicated. I
The
mean,
one
it's
just came in.
Yeah.
Oh, sorry.
No, go.
Do you see waivers that use multiple institutional level of care levels for eligibility, such as intermediate care facility and nursing facility level of care?
Yeah, there are some. Again, you can define that. So that's one of the things that you can define within your waiver, is what those levels of care are. So you can define that waiver is based on these levels of care. So there are some that are mixed. I'm trying to think where I just saw that today, but I did as I was trying to prepare for this. So yes, I think the answer is yes. Now, if you would ask me where, I'd have to say I'm not sure, but yes, I believe so, because that's one of the things you can waive is, in effect, you're waiving the institutionalization. So what you're saying is you're waiving institutionalization, hospitalization, and nursing home. I mean, you're waiving the whole shebang as opposed to one or the other.
What is your opinion on the state's responsibility to help those who are not being helped by waivers and fall outside of those qualifications?
Oh, you're trying to get me to, okay, that was a tricky question. You know, here's how I'll answer that. Here's how I'll answer that. I think people need to get what they need to get. But having said that, states need to pay, states and the federal government have to pay for that, and there has to be money to pay for that. So how do you have that conversation and have those things paid for? I mean, if you say to me, and I've had this conversation with people, you say to me, I think, you know, I should get these services. I don't want to be under managed care. I want to be in fee for service. I don't want to have any waiting lists. I don't want to have taxes raised in my state. Again, not a political statement, just the money's not there and I don't want to find it any other place. There's a balancing act in this, as in anything. And asking that question, and again, back to share your expertise and your experience and your opinions. And that's important. And that's a question, all of those questions, I think, need to be asked of all states, and whether it's policymakers or those conversations need to happen across the board. And it's a combination of people having those conversations. It's a combination of self-advocates and parents and what I would call state bureaucrats and providers and insurance companies and having that conversation to say, you know, how close to the ideal can we get? And how do we get there? And I really walked right around that question in some ways, but it's probably as good as you're going to get from me tonight.
Perfect. Thank you. That was all the questions for now.
Thanks.
And then Denise, did you say you were planning to stick with us for a little while? So if we do have any other questions that come through, you'll be available. Okay, wonderful, wonderful. So now we're going to kind of switch gears a little bit, and we're going to have Moriah Demers from Minnesota share with us her family stories about utilizing waiver services in Minnesota. And I think I might have to unmute you.
Yes, there we go. All right, so my name's Moriah. I live in Lakeville, Minnesota, which is a suburb of the Twin Cities. I have a son, he's almost 8 years old, and he was diagnosed with autism when he was 2. So we've been on a journey with Medicaid and waivers for 6 years now. There's a lot of different options in Minnesota. Minnesota actually has some pretty great programs for people with disabilities. There's several different waiver options, and I haven't had an experience with all of those waivers, but I can kind of go over my story of where you start in Minnesota with your services. the first step when your child is diagnosed is to go through something called the State Medical Review Team, which is they shorten it to SMRT, which is kind of a funny word. What they do is they review your child's medical records and decide if your child is disabled. So once they've determined that, they send that information back to your county, and from there your county will go over the different benefits available to your child. Kind of the first step benefits before they look at waivers in Minnesota is Family Support Grant or the Consumer Support Grant, and those are both state funded. The Family Support Grant is typically a one-time budget given to you, so you can use it for like paying medical bills, or you can purchase equipment for your child, or pay for a personal care attendant to have some respite, or whatever you want to do with it. It's a pretty small amount. It's about $3,000, and you can get it once a year. From there, they have the Consumer Support Grant, which is really popular for families with young children. It's also a state-funded program, and they give you a budget. Now you can either choose to have this budget and spend it kind of on things that you choose. So you can say, oh, I want to have some personal care attendant, and I want to do this therapy, and I want to purchase this piece of equipment for my child. And or you can choose just to have a personal care attendant for 20 hours a week or whatever. So some people choose one or the other for a Consumer Support Grant. And I know for a while we did where we just had a personal care attendant that would work with my son, and we did that for a few years. They're notoriously difficult to remain staffed. So Minnesota has quite an issue with, we really like to provide personal care attendants for people with disabilities, but we have a really difficult time staffing. So you can also do an option with the CSG or with waivers in Minnesota is something called paid parent, where you as a parent can be paid support staff for your child. There is different things that they're looking for when you're creating a budget that has paid parents in it. I know that's not a typical use for waiver funds, and Minnesota is unusual that they do that. So one other thing I wanted to go back to is in Minnesota, I think we had mentioned TEFRA before in the presentation. TEFRA is the Tax Equity and Financial Responsibility Act. And in Minnesota, they have a fee for people, for kids on Medicaid if their parents are over the income limits for qualifying for Medicaid. So you do have a parental fee if you have a certain income. So I know people that, unfortunately, their fee can be several $1,000s a month. And they kind of have to weigh their options on whether, is it worth paying this to have my kid on the waiver and be able to access different things with Medicaid. So say, for example, your child needs ABA services for autism. That can be really costly. It can be a couple $100,000s a year. And say your private insurance that you have through your job covers 75% of that, but you still end up with $50,000 a year that you need paid. If you have Medicaid, Medicaid would cover those costs for you, but you have to weigh that against however much you're paying for a Medicaid fee. So it can be difficult for families to come up with the funds for those fees. And one of the ways that people offset that is by doing paid parent through their waiver. So they're paying themselves from their waiver, and the money goes back to paying for TEFRA. It's a complicated process. So when I first started this journey and learning about the services that were available in Minnesota, our first step was actually like early childhood support people that were telling us about it. So we had like, we call them ECSE here. I don't know if they're called in all states, but his first teacher, she was like a speech therapist kind of person. And she brought up to us like the different programs available for us. And then from there, actually, I think this is a huge resource for a lot of parents is Facebook, is the Facebook groups. So if you are kind of new to everything, search out Facebook groups in your state or even your county, and you will find out a ton of information from other parents. So just today I was looking on a Facebook group for special needs parents in Minnesota, and there was a person who was looking at moving to Minnesota and was asking a lot of questions about waivers. She was on a waiver in another state. So it's something that you can just find out so much information just by going on Facebook groups specifically and even searching for waivers or whatever it is you're looking for. So, so a couple years ago was when Spencer's, when the county first brought up to us, his social worker brought up that we could look at having him on a waiver. So we had been on that consumer support grant for a couple years, and I had kept going back to the county and saying, hey, this isn't quite working. This isn't quite working. They want to see that you demonstrate that the consumer support grant's not working for you before they'll allow you access to a waiver. So even though he may have technically qualified for a waiver the whole time, since they first assessed him, they were resistant to putting him on one. So although they say in Minnesota there's no waits for waivers, there kind of is. It's really rare for you to see a really young child on a waiver. I think there's certain disabilities that are more common for really young kids to be on a waiver, but I'd say most kids that you see on waivers, they're not till they're like 5 or 6 years old in Minnesota, unless there's like really extraneous circumstances that they're dealing with. So like the kid is like dependent on a lot of nursing services and stuff like that. So right now there's quite a few different waivers in Minnesota, and I don't want to go into them specifically because I'm not an expert on them, and I know Rhonda has more information. The waiver that we are on is Developmental Disabilities Waiver, and he specifically uses the Consumer Directed Community Support option, which is a CDCS option, and that allows us to basically make decisions on how the money is used based on what works best for our family and for my son. So what we use the services for is therapies. And of course, this is all going back to pre-COVID. We haven't really used funds for much during COVID. It hasn't been as fun and trying different things for him. But so there's things like evidence-based therapies that aren't covered under Medicaid. So you can access things like HIPAA therapy, which is like horse therapy, or we can look at swim therapy for him. So things that wouldn't be covered under Medicaid or insurance, but are still have evidence behind them to show that they're proven and therapeutic. We've used it for things like equipment. He really loves swinging and it's very soothing for him. So we have like swings, like heavy duty swings installed in our basement that he goes down, and some days he'll be down there for 2 hours just on a swing. So that's like a home modification or equipment that we can use it for. We do have a personal care attendant that works with us in the summers. We've had him full-time in the past. We've had him part-time as much as we can keep somebody on staff. And like I said, we mentioned, we do use paid parent option as well. So I'm his kind of main personal care attendant for different activities of daily living where he needs supports. So, so yeah, there's a lot of different things, especially when you in Minnesota, when you use the consumer directed community support options of how you can spend the funds in your waiver. But it's nice that it's so flexible. There is still traditional waivers in Minnesota too, but I don't know a lot of people who use those options for a traditional waiver because they're a lot more strict about how you spend those funds. I think in the end, like I didn't realize when kind of started all of this with Spencer, how fortunate we were to be in Minnesota. I know that over the years, learning about programs in other states, I've found that, yes, honey, that,
What's that?
Minnesota is very, I guess, flexible with families, and they do have a lot of options for families, for kids with disabilities. And it's been really fortunate for our family to have these great supports in Minnesota. I think it's not always easy. There's a lot of bureaucracy to move around in, to learn. And I'm really, like I mentioned before, I'm really, really fortunate to have the supports that I found through other parents. So I'd say, like, you know, if you're starting out your journey, if you've been in it for a while and you haven't accessed like different parent support groups, that's going to be huge in kind of finding out what's available in your community, in your state, and also for helping you get involved if you think that things need to change or if there's other options that should be available in your state, in networking with those families to try to figure out, you know, what would make the most sense here. I've seen even just in the few short years I've been involved in Minnesota, as people make a lot of change when they get together and they discuss about, you know, what could be different, how could this work better for our families. So.
Thank you so much, Moriah. It was great to see Spencer there too as well. Jennifer, do we have any questions for Moriah? Okay, great.
Yes. So you mentioned the county board. Is everything done by county, or is it a state decision when you're approved for the waivers?
Oh, it's definitely done by county. So in Minnesota, it has this thing too, where there's like better counties than other counties. So like some counties are really strict with how they will assign waivers, and some are, I guess, more relaxed. Some counties will approve your requests in your waiver, and some will say, no way, we can never do this. And some will be like, great, yeah, let's go ahead and try this, you know, like a certain therapy or something. Like maybe one county doesn't want to approve HIPAA therapy and one does. So it's definitely county by county.
That's interesting. Okay.
Yeah.
That was all for questions right now.
Okay, well, we're going to keep you
Thank
on
you.
retainer. So in case we have more that come through, we can circle back. And next we have Saige Vohs to share some of the services that her family has utilized in North Dakota.
Hi, so I'm Saige Vohs, and that's fine.
Sorry.
No, that's fine. It doesn't matter. I have a 4-year-old who has a diagnosis of autism, and I have a 2-year-old who would be considered neurotypical. But tonight I'm going to talk about my son. His name is Bodhi, and around 18 months old, I noticed Bodhi was having some signs or symptoms of autism. We were living in Nebraska at the time. I didn't know anything as a parent, and I'm still learning. I know now definitely how important it is to know. We moved to North Dakota. I got a job there and we moved there, and everything was very easy for us. We were working with early childhood development services here in Nebraska, and they made a referral for us when we moved to North Dakota to Minot, where we were moving to, and early childhood services in Minot made a referral for DD services for us, and they called me and scheduled an appointment before we even were living there. Everything was really, they did a lot for us. I didn't have the knowledge that I needed then, and then my son was eligible for DD services automatically right away. And because of it, he received speech therapy that he needs. He doesn't use any words, and he received OT therapy that he needs. And he got respite care at a place he got to go to for respite care, which was really nice, especially since there's a second one in the house, another child. That made it nice to take him somewhere to drop him off. It was his special time too. Benefited him as much as it benefited our family. It was important for us to move back to Nebraska. It was something that we needed as a family because my family's in Nebraska. And I tried to look into what things were going to change as much as I could. A big problem we ran into is that nobody told us the same information. We heard different information from everybody. Nobody said the same thing. It was hard to figure out anything. It was hard to get answers. It was hard to learn anything. We made the move. It was something I really had to sit down and decide. I'd like to say I made a pros and cons list. I didn't, but I just knew what decision we needed to make. So we moved back to Nebraska, and my son lost all of his services when we moved back. We've been made eligible for DD. We're on the wait list, of course. It's very long, is what I've learned. As far as I know, there was no wait list in North Dakota. As far as I know, I never heard of any wait list. My son was eligible for home and community-based services as soon as we moved there, when he turned 3 years old, he was made eligible as an adult with a diagnosis from a psychologist. And he would have been eligible until he turned 19, and then there would have been some redetermination. But I never heard, and we would have been eligible for the autism waiver also. So there were lots of options there. Quiet, please. But not a lot of resources. So we've always wanted ABA, or I have always wanted ABA therapy or services for my son, and we were on a wait list for those. So we were on a wait list. He was number 4 on the list in Minot, and then we were on that list for 2 years. And by the time we moved, he'd been moved up to number 2 on that wait list. So we had the resources we needed as far as Medicaid went, but we didn't have the providers that we needed. Now we're in Omaha, and it's the opposite. We have available providers, but it's expensive. So so we don't have speech therapy or occupational therapy or any of that anymore. Or we have some respite though. And I think that's about it.
Thank you, Saige.
Yeah.
Does anyone have any questions for Saige?
Yes, we had one come in. So when your son was on the waiver, what types of services was he getting?
Yeah, so he got speech therapy and he got occupational therapy. He would have been able to get ABA therapy, but we were on the wait list for that, so we never actually got that. And then we got respite care services too.
And then did you have specialized childcare? Do you know if that was an option? No.
That was not an option, but definitely something that would have benefited us greatly. My son was kicked out of one daycare on day 3. So we had a lot of issues with that, and definitely something that was a need for us, but something that we have never received.
That is all the questions that I have right now. Thank you, Saige.
Yes, thank you, Saige. So I guess I will just share a little bit about our family. So my name is Rhonda Haitz, and my family, it's me and my husband, Eric, our daughter, Ella, who is 14 and has Down syndrome. She is now a freshman in high school. Tucker is our son. He's 12 and neurotypical, and he's in 7th grade, and Abby, the German Shepherd. We live in Iowa, and I believe Iowa has 7 waiver programs. Ella is on the intellectual disability waiver. Previously, it was called the MR waiver, which anyways, but it's very similar to the DD waiver in Nebraska. I know they have an aged and disabled. Another one that we work with sometimes is the children's mental health waiver, because sometimes that can cover some things with behavioral health issues for kiddos with autism. Other programs that we have utilized in Iowa. When Ella was born, okay, so this is she was born in 2006, and that was pre-ACA, and we had huge problems with insurance, just because I worked for a small nonprofit and my husband worked for a small business. And so our plan had been to put baby on her own insurance policy. But when your baby is born with a genetic condition and holes in her heart and can't breathe, and nobody wants to insure her. So that was not an option to put her on her own private policy. So we had some difficult conversations with social workers about me quitting my job so that we could income qualify for Medicaid. What ended up happening is we utilized a program. So during that time, the nonprofit I was working at, I was actually a rent payee. And part of my job was filling out these forms for other people with disabilities who did not have someone to help them with that or to do that. So as I'm sitting in the hospital, Ella's in the NICU, I'm filling out paperwork for both the Med Needy program in Iowa and the DD waiver. So the Med Needy program basically was something that would take a look at your income each month, and there's a spend down. So we had a certain amount that we had to meet, and then after that amount, this basically Medicaid paid that. So so for the month she was born in, when we started getting those like $80,000 bills because she didn't have insurance from the NICU, we paid based off of the calculations, whatever, whatever thousand, and then they paid the rest. So that was huge because I was really scared during that time. That was just a really, really scary time. So that was helpful kind of in the short term. Another program that I think is cool that Iowa has is the Iowa Autism Support Program, which provides ABA services only to children under the age of 14 who are not eligible for ABA through Medicaid or private insurance. And the income guidelines go up to 500% of the federal poverty level, but for, as an example, a family of four, that's $123,000 adjusted gross income. Over 200% of the federal poverty level, there is a cost share, so that is something. But I think that's one of the, ABA is so expensive that, and we know it's like one of those, like the golden rule or the golden standard as far as services, that's something that I know families have been turning to. How did we learn about services? Well, like I said, I was already filling out a lot of this types of program paperwork for people prior to knowing that Ella was coming along. So, but I think most people probably either find out, we had the EDN or the Early Development Network, it's called Early Access in Iowa. They started working with us in home at like 6 weeks. So they provided a lot of information. They had a parent support group. But I would say either your early intervention program or parent groups is where most people seem to find out about those other types of programs. What services do we utilize? So one of the things that I was most concerned about is Ella had a lot of health issues, and we were really hoping to have access to Medicaid. Again, pre-ACA and having, born with pre-existing conditions is kind of difficult. So for instance, at one point in time, insurance and employment have always been some of the most difficult things navigating, I think, with having a kiddo with special needs. And so there was times where I've had to leave the workforce or reduce my hours at work to accommodate what Ella needs. And then that affects my insurance. So long story short, there's been times where like we needed that because insurance was so expensive. Even through an employer-based insurance, like when we moved here, we were able to, I needed to know that she was taken care of, and that it became something that was a source of peace for me, that we weren't going to have to worry about paying for what she needed. And this is a small example. So like Ella did PT, OT, and speech for 7 years every week. And we had a $50 copay with our private insurance, which doesn't sound bad. Like it really isn't. Like it's not. But when you add that up, well, that's $150 a week. That's $600 a month. And we are not wealthy people. So so that's one piece, not to mention endocrinology or GI, or when we have to go to the ENT, and she typically has at least one surgery a year, just on average. That's where we're kind of averaging out right now. So, it's all of those things, the medication she has to take, the medical equipment she needs. She has she has a CPAP. So all of those things, they just add up. And I was going from the experience of when she was born was really scary. I remember laying on the floor with her in her car seat, and we didn't know if the holes were going to close in her heart, and we didn't know if she was going to have to be on oxygen because of the breathing issues that she was having. And I'm like, I don't know if I can pay for these things. So that was really difficult. Another thing that we utilize is respite, which is really, really important for families to be able to access and get a break. It's nice to have a date night with my husband. It is nice to have time with my son where he is not having to share us or being limited to what we can do because we have to think of how Ella will tolerate that activity. And he gets to pick. She loves it because she goes to our respite provider and they do group respite, and it's like a big slumber party. And so she has her little suitcase and she carries her CPAP and she's like, see ya. And those opportunities actually are things that help foster a lot of independence for her. We've also used them for camp. So she has done Camp High Hopes in Sioux City. I think it's similar to Easter Seals. I just liked Sioux City because my parents were there. So if something went wrong, they were close by. But she has gone all week long, done the week-long camp. And I think the week-long camp is like $600 a week. And you can use respite funds for that because it's overnight. And so she's just gotten these opportunities. She's like, I was in a canoe today and I went and used a bow and arrow, and next we're doing karaoke. And I'm like, have a great time. See you later. And it's been real. She comes back with more confidence from those trips. And it's really neat to see that. Supported community living. So those were things where we would set goals and she would work on skills. So once we had some safety goals, like crossing the street or how to in a parking lot, that was a problem for a while because she would run out in front of cars. Cooking, getting dressed when she was little, feeding when she was little. We also had the option, it's called Consumer Choice Option in Iowa, where we could basically get a set amount of money where we could then decide how it was allocated and who we hired and set the pay rate. So this was really nice when Ella was little because we were able to have my mom be our respite provider, and who is a nurse. Ella had lots of breathing problems when she was little, and I was really nervous about leaving her anywhere because we're talking when she's 6 months old. And it gave us flexibility, to use it for the things that were most important to us. I think I'm getting a new appreciation for how this will benefit us as Ella is now in high school and reaching transition age. It's like a whole new world and it's a little scary, but that's where the supports that she's going to need through transition and into adulthood are probably going to come from. So it's been really, really important to us. We did not have to wait on a wait list in 2016. At that time, there wasn't one. There is now in Iowa. And I think the last time I heard it was either 18 or 24 months. So I guess overall, these were really, really important to our family, feeling like it was just a safety net. It was something that was, when you're looking at hospital bills and you're trying to negotiate a rate on your bills with the hospital that are more than your mortgage, and there's more coming in because you're not done with it yet, it's scary. I think it's really important to have those times when you can have a break If you don't have a break, I think parents get really burn out. They get really tired, and it can put a strain on a marriage, relationships with other people. And you can sometimes only dig so deep in the well before it runs dry. And so if you can find ways to try to fill that bucket, it's just really amazing to do something where you're not having to make accommodations at every single turn. And not to say I don't love my daughter, but it's just nice to be able to breathe and relax a little bit sometimes, and to have that as a possibility. Having the waiver helped me so I could sleep at night. It took one huge worry off of my plate, and it actually gave me peace, because I know that at least on that basic level, we have that covered and figured out for her. So when we looked at moving, we used to live in Sioux City, which is about 90 minutes or 90 miles, whatever, north of Omaha, and also in Iowa, but right on the border. And so Ella was already on the waiver when we moved here. My husband got a job at Omaha Public Schools. And when we moved, kind of just looking at what was available, I reached out to the Down syndrome support group in Omaha, and just find out like if they had could refer any information about what types of services were available. And it was kind of confusing as far as and I think there is still some confusion over income, would you not qualify? Do they count it? Do they not? And the idea of the wait list meant that Ella would have lost the services that she had in Iowa to become a Nebraska resident. So we purchased a home in Iowa so that she could maintain the benefits she already had. So that's kind of our story. I guess, does anyone have any questions?
We had one come in with regard to Medicaid. And it's just curiosity. They said that I've heard some places in Omaha will not take Iowa Medicaid. Is that something you've encountered?
Oh, okay. So I think this is something that Denise alluded to earlier. So I think it's been about 5 years ago, Iowa decided to privatize their Medicaid options. So we have been on 4 different plans in that time because insurance companies keep pulling out of Iowa. So that has been fun. So every time that happens or a new one comes in, you have to check with all of your providers to see if they are participating in that particular plan. So I think that's been one of the things that has happened it's made it really difficult for providers because they have to go through this whole application process every time that changes. So it's difficult on both ends. The other thing is, I think there has been a problem as far as reimbursement rates, and that Iowa Medicaid reimbursement rates have been not fantastic. I mean, I don't know that they're great to begin with across the board, but there seems to be a problem there. And so I think it's become problematic in some situations because you're essentially hunting for providers. That's what we've experienced anyways. So every time we got switched to a different plan, because it was never our choice, we never chose to switch it up. They just weren't going to participate anymore in the program. And so we got moved to another plan, or we had a choice of what was left. And so it's been kind of, at least from my perspective, and I don't know, I know, again, like our experience with it, it's been messy. This process, I think we're probably fortunate because I think a lot of people, others in Iowa, depending on the types of services and how they, what their needs are. It has been a lot messier for them.
Okay, and this is for all three of the panelists. With the waiver services that you have in the states that you're in Saige, North Dakota, what was the most beneficial long-term services and support service that you had? And if you could add one service or had one wish that would be added to the waiver for your family, what would it be? We probably
Okay,
need
well,
to
I
unmute
will.
you guys, don't we?
Okay, Jennifer, if you wouldn't mind, if I could pick something that we don't currently have access to, that I think is huge and that is something that we have struggled with over and over and over again, is childcare. Having access to Ella is now 14, and so we've run into problems at kindergarten, which turned into a huge thing. We ran into problems every summer when she's not in school, and it's become even more difficult after she turned 12, because in Iowa, their traditional daycares will not accept anybody over the age of 12. So we're in this like weird hole between 12 and 16 when she can qualify for adult services during the summertime. And so it's like this patchwork quilt of trying to figure out, this week she's going to go to this grandma, this week she goes to this camp, this week we'll go on vacation, this week we'll go to this camp, other grandmas available, this camp, and then we're going to, not last summer because COVID, but the summer before that, like our kids were home during the summer, maybe 2 weeks. And it was awful. And it was because we had to keep farming them out to relatives because we had nobody to watch them.
So is that because Iowa doesn't provide funding for specialized childcare, or because there is no?
We don't have childcare as part of the waiver. So if I was to dream at this point, I might have different dreams. I think it's different as they get older too, but like right now, this is where we're at. And this has been a problem since day one, is having adequate and appropriate childcare for her.
That's really funny that you're talking about the childcare thing, because I never even thought that that's something that could be covered. Like just thinking about that and you talking about that, like that would be amazing to have that option for like a special needs childcare. That was something that, you know, my son was in ABA therapy for 5 years, and it was kind of like a 9-to-5 type place, but it was still really difficult. Like there was no like wiggle room with the time of pickup and drop off, and like whose job specifically is like 9 to 5 and that's it. You can't go outside these hours. So it was incredibly difficult with working hours, and like there was no options for childcare. And so in Minnesota, we do have personal care attendants, but that's if you can find one, and they can work with your child at home. But if I'd say probably 80 to 90% of people I know that need a PCA can't find one. So it's not a great option, but I really love that idea. Like Saige, where you said it, there's the childcare kind of stuff in North Dakota. Like that sounds really amazing. Actually, they help you find that kind of placement. So.
Yeah, we didn't have it in North Dakota. I wish we would have.
Oh.
That's okay. I think that our situation is a little different. For me, just having the option now to be on a waiver would be fantastic. Of course, for North Dakota, though, childcare would have been amazing, and transportation would have been huge, because in a 8-to-5 job, there was no wiggle room as far as taking him to speech or taking him to OT. So those things had to be done with, taking 2 toddlers with you. And those things had to be done at like 6 a.m. or right after school. But, there's supper, there's baths, there's bedtime, there's all those other things that make it really stressful during the week. And those kinds of things are only provided during the week. So I suppose some flexibility with some of that, or transportation would have been great, but I don't know, maybe a personal attendant could help with that. That sounds pretty fantastic, I think, too. My day as a single mom is really stressful, and it's honestly a break for me to go to work or to be working. So having someone to help with some of those needs in the home, I think would be huge too.
And I think that, and I don't know if this kind of piggybacks off of this, but this is, conversations that we have lots of conversations. But I think that's one of the things, is that those are also the types of supports that not only it keeps the child, or for us anyways, that individual in the home, but it also helps me stay employed. It also, which is something I need. I did stay at home for 3 years. It was not fun for me. I love my kids, but I did not do well. I did not thrive in that environment. And, but it's really hard when you're getting called every day from, because there's nowhere for your child to go after school. And am I supposed to quit my job then because I have nowhere for her to go from 4 o'clock till 5 when I can be home? That was a conversation we had to have at one point in time. So it's really supporting that entire family, in my opinion, because we're all, it takes all of us to keep her here.
Okay, and we have another question for the moms. What helpful advice would you give to professionals working with families with children with disabilities that you would like them to know?
One of the great things that I think that I had already with early childhood development in North Dakota was we had somebody come to the house that was an OT, and she used to work in the schools. She was fantastic, and she really actually helped us a whole lot in our home. But the greatest thing I think she did for me was she listened. She listened. She let me talk about the struggles or the difficulties, and I needed that. I just needed somebody to listen and somebody to care. And that was a big deal for us. And I think that any professional that we work with, that I talk to, I want them to understand, I guess, a parent's point of view, and let them talk.
So I'm trying to think back of, like, I'd say it's been a few years where we've really been dealing with a ton of professionals anymore. Like when he was younger, I felt like there was somebody new every week that we were dealing with. And I think one thing that was really important to me was, oddly enough, getting correct information. Sometimes I would get incorrect information from people that should not be providing incorrect information, especially when it came to stuff like waivers and community supports. I understand it's a difficult thing, but I almost felt like there was a handful of people who like to talk about stuff that maybe weren't necessarily experts on the subject, and we were given some wrong information when he was young. So I'd say, leaving that information up to the professionals would be one thing. But the vast majority of people we dealt with were really, really helpful. And we wouldn't be where we are now without the help of all the people, the professionals we've dealt with, and mental health and county and, early childhood and all that. So I really appreciate what everyone's done. I'm just thinking there's a couple times where people told us stuff that wasn't quite accurate and made the process a little bit more difficult. So.
And I guess I would just kind of piggyback off of you know, both Saige and Moriah, I think being heard is such an important thing for a family member or a parent. Because sometimes it can be kind of isolating, and not everybody understands what life is like for us. And so to just take the time to kind of listen and hear. And I think Moriah had a great point as far as like, it's okay to say, I don't know. And if you can direct somebody, and if you just have like one person, and hopefully that's maybe something that we're able to provide. I do that a lot. I say, I don't know, but I know a lot of smart people. So I can like see what I can find out, because I would much rather have someone say like, you know what, I'm not sure. Let's check on that. Let's make sure we've got the up-to-date information. And maybe there's someone else who that's more their wheelhouse, and that's totally fine. I much would rather hear that than get sent down kind of a rabbit hole and end up being something that makes things difficult, or we've missed a timeline. So yeah.
Okay. It looks like that's all the questions that are in the chat right now, but I did want to ask if Denise is still around and if she's up for another question. We heard all three of the moms reference childcare and transportation. Have you seen anything innovative or anything that's been used in any of the states to kind of address those needs that you're aware of? Oh, sorry, I'll unmute you, sorry.
There we go. I think the transportation one is a little bit easier because I think there are a number of waivers that will cover transportation services in one way or another. So that one's a little easier, particularly for adults. They'll cover transportation services. That's a whole different, get to the work and kind of stuff. But I think for some others as well, and there are some that cover childcare as well. I would have to go look up to see who and where those waivers are. But yeah, those kinds of things are available in various states. I think the Maryland example I gave you on the family support waiver there, I think would cover probably both of those things. But I'd have to double check and see. But I would guess that it probably would, because the whole point of it is you've got person-centered care, you've got person-centered planning. So what is it that the family and the kiddo need? And then that, if you're on the waiver, that's what gets, where you spend your money, because you have a budget. And if you can make the argument for why that's important, that's kind of how family support waivers work. So I think my guess is yes, that both of those would be covered under the Maryland waiver, but I could check that.
I did just want to mention that specialized childcare is covered in Nebraska on the aged and disabled waiver. There is just a parental portion, and then the waiver pays above and beyond that. Yeah,
there's one. The specialized, both of those are things that I think you're going to find in a variety of places. They're neither one that unusual, I don't think.
That's all I have for questions. I don't know if there's still have time.
Wonderful. Well, what I may do, I'm going to go ahead and put the poll up for everyone, just so that we can kind of get some feedback to see if this was helpful. And if you have any other additional comments, feel free to email either myself or Jennifer. But give you a few minutes to do that. And then if you think of anything else real quick before we decide to sign off for tonight, I'll give you an opportunity to do that. I do want to thank everyone who came to visit with us this evening to learn some information, for Denise for sharing all of your wisdom with us, and kind of putting some clarification on this really complicated and kind of difficult to navigate topic. And our guest speakers, parent advocates, Saige, Vohs. Is that right? Okay, good. And Moriah Demers. And thank you so much for coming and sharing your stories for your family and your kiddos. We really appreciate it. And I think that helps put a spin on how things that we talk about in policy affect real life. And so I really appreciate you sharing that perspective as well.